Before we open up the Senate Finance Committee, I just want to just say just a little bit about our schedule going forward. And I know there's going to be a lot going on. Today's a big day, of course. We're going to have finance, so you have to be very nimble and watch your emails. But also, I'm hoping that we're all somewhat patient and a little bit gracious about this Zoom. There was a roll call last night, and I felt like I was getting pressure to get it finished, but apparently one of our members' computers went off. I was looking at the chat. We need to just everybody just like realize that there's a lot going on with this Zoom, and it's very hard to make everything happen exactly right. So I myself need to be more patient, and that Senator Champion, I will try to be more patient. I promise you that. And I know Senator Marty has felt my Italian passion, but let's just try to make this work, because we do have a very heavy schedule the next 4 days. Okay. With that, I call the Senate Finance Committee to order. It's Thursday, May 14th, 2020. We have 5 bills on the agenda, and we're going to try to get through 3 this morning. I know we have Senator Utke's, Senator Housley's, and Senator Nelson's. Hopefully we can get through that this morning. We have session at 10. First up, we have Senate File 4130. Senator Utke is a workers' compensation bill, and welcome, Senator Utke.
Thank you, Madam Chair, and good morning to you and the members. Madam Chair, if we could, I would like to probably start out by offering the A3 amendment.
Well, Senator Utke, we'll have to have Senator Ingebrigtsen have the A3 amendment. Can you explain it before we vote on it, please?
Yes, and do the members all have a copy?
That was just emailed probably a half an hour ago, so everybody should have it.
We're all on the same page, and I just got mine a little bit ago too. But when you do look at it, and this is the work comp bill, but what we're dealing with today is a reimbursement plan for the COVID-19 expenses. And the A3 amendment, if you go back to section 23, just makes a few technical changes, and it does 3 things. Technical change correcting the name of the fund, a technical change correcting a cross-reference, and removes MMB's ability to cancel the program if they don't feel it's explicitly allowed. That's what the amendment does to this bill.
Thank you. That sounds very reasonable. Senator Ingebrigtsen, would you like to move the A3 amendment for Senator Utke?
So moved.
Thank you. Senator Ingebrigtsen moves the A3 amendment. Please unmute. Put on your video. Okay, wonderful. All those in favor of the A3 amendment, please say aye.
Aye.
Aye. All those opposed, nay. Motion prevails. A3 amendment is adopted. To your bill, Senator Utke.
Thank you. And members, Senate File 4130 is this year's workers' compensation policy bill for this session, and it has been heard previously in jobs and yesterday in state government. But we are here today because of the funding side of it. And yesterday we added what is now section 22 and 23 of the bill, which is a reimbursement proposal for the COVID-19 related expenses incurred because of the presumptive eligibility classes added to the workers' compensation chapter of law when House File 4537 was passed and signed into law this past April 7th. While this provides protection for our frontline workers during the COVID-19 epidemic, many of the entities that employ these workers are cash-strapped at the moment. For example, local governments employ firefighters, police officers, and often EMTs. Hospitals and long-term care facilities employ doctors and nurses. Neither of these employers are doing well at the moment. We're particularly concerned about local governments. They often don't have substantial reserves, and their only option for raising revenue is increasing property taxes or cutting services. The following is information from the League of Minnesota Cities Insurance Trust. The League of Minnesota Cities Insurance Trust is a self-insured insurance pool providing workers' compensation coverage to almost all cities and standalone police and fire departments in Minnesota, except for 9 large self-insured cities. The League of Minnesota Cities Insurance Trust is a public joint powers entity owned and managed by their members, cities, and is a sister entity to the League of Minnesota Cities, which provides research, training, and other services to our cities. They endorsed the initial presumption legislation to extend needed financial protection to the public safety and healthcare workers who are on the front lines in dealing with the pandemic. Their concerns about how to sustainably fund this prompted them to begin conversations with their colleagues at other local government pools and affected self-insured entities. That grew into a conversation with a wide range of stakeholders and ultimately led to the creation of this bill. That group of stakeholders includes the League of Minnesota Cities and the League of Minnesota Cities Insurance Trust, Minnesota Association of Townships and Minnesota Association of Townships Insurance Trust, Association of Minnesota Counties and Minnesota Counties Insurance Trust, Minnesota Inter-County Association, Minnesota School Board Association, Self-Insured Cities and Counties, Insurance Federation of Minnesota, Minnesota Chamber of Commerce, Minnesota Hospital Association, the Minnesota Employers Workers' Compensation Alliance, Minnesota Self-Insurance Group, Minnesota's Chief of Police Association, Minnesota Fire Chiefs Association, and public safety labor organizations. And I have information from the Minnesota Self-Insured Group also, an advocacy organization for group workers' compensation funds. Minnesota's Self-Insured Group represents over 1,000 Minnesota employers participating in self-funded group workers' compensation funds. While they agree with and fully support the presumptive legislation extending workers' compensation benefits to frontline healthcare workers, that legislation has created a financial threat to Minnesota self-funded workers' compensation groups specializing in healthcare. These 3 self-funded groups, Greater Minnesota Self-Insured Workers' Compensation Fund, consisting of hospitals in Cloquet, Aiken, and Malacca, Care Providers Self-Insured Workers' Compensation Fund, consisting of home health care and facility-based health care of vulnerable populations, and Healthcare Select Self-Insured Workers' Compensation Fund, consisting of nursing home operations throughout Minnesota, employ nearly 10,000 frontline healthcare employees and are already experiencing reported positive COVID-19 diagnosis on their staff. The financial burden of the COVID-19 claims was unforeseen, unfunded, and unbudgeted. With presumptive causation, the costs are now also unavoidable. The 3 groups are of relatively modest size, with total annual premiums ranging from $900,000 to $2 million. Uncapped claim costs projected for COVID-19 claims would likely drive these 3 self-funded groups, which have each begun operating successfully since 2004, out of business. The frontline healthcare workers employed by these private employers were provided presumptive causation under the same terms as the public first responders and healthcare employees. These private self-funded healthcare groups should receive the same consideration for funding of the costs as public entities. What type of costs are we talking about? The Department of Commerce and the Department of Labor and Industry coordinated in a rough modeling of the cost to the workers' compensation system for the presumptive class workers. The range was from 251 to 495 million for the year. How are reimbursements determined? Self-insured local government entity, a local government self-insured pool, or group self-insure with presumptive class workers and an annual premium less than $5 million would have an aggregate deductible of $100,000. That is, when one of these additional entities paid total COVID-related workers' compensation costs of $100,000, For claims arising from employees in one of the classes covered by the presumption, that entity would become eligible for reimbursement by the fund for any additional such costs. All other entities would have an aggregate deductible of $1 million. That is, when these other individual entities paid total COVID-related workers' compensation costs of $1 million for claims arising from employees in one of the classes covered by the presumption, that entity would become eligible for reimbursement by the fund for any additional such costs. The two-tiered deductible structure is designed to ensure that local governments and the smallest employers get more help, while the larger systems are still supported at a somewhat lower level. The fund's obligation to pay would be reduced by the amount of any work comp, reinsurance, or other third-party sources of payment to the workers' compensation provider. Any claimant within the presumptive job class counts towards the deductible and is eligible for reimbursement. This bill provides $375 million from the federal funds we've received to cover these costs for the affected employers. Additionally, we're requiring reporting to the legislature on August 1st and November 1st. So if claims experience is lower than expected, we can recapture some of the funding for other purposes. Since the federal funds are only available until December 30th, the estimated costs are reduced to the $375 million in the bill to correspond with the December 30th date. We believe the $375 million will be sufficient, but there is still substantial uncertainty in the modeling we've received. A couple of additional items. Some have questioned who are eligible for this reimbursement for the costs related to the COVID-19 because we are using federal funds. From everything we have heard concerning temporary charges related to COVID-19, this plan would be eligible. This bill language is consistent with the other COVID-19 bills that have come before us this year. This bill is about reimbursing the excess costs incurred from our frontline workers due to the COVID-19 crisis. Just as a little bit of data and numbers from the Department of Labor and Industry, the total claims to date, or actually the total claims to May 8th were in the hospitals, 116, long-term care and residential facilities, there was 124 claims. And then there was other breakdowns up to a total of 389 claims from the time that the original bill was signed and up through the May 8th. Members, we are committed to helping our frontline workers with, we workers with House File 4537, which we passed on April 7th. But we did not have a funding source at that time to pay the obligations. This bill before us today completes that commitment to provide the health care needed by the employees and to pay the additional costs incurred from the COVID-19 virus. With that, Madam Chair, I would stand for any questions.
Thank you, Senator Utke. That's a very good explanation. And we have Mr. Mumm, our fiscal analyst, who could go through any other points that Senator Utke didn't touch on, and Ms. Fontaine also to assist with the amendment or the bill. I do have a question, Senator Utke, if you would like, and then perhaps Mr. Mumm could answer it. You said there's 389 claims to date. What is the price on that, on those claims? Do you have any idea?
Madam Chair, I just looking here quick, no, all I've got is the numbers, and that actually was through May 8th. And this is information off the Department of Labor and Industry, I believe off their website is where it came from. So it's just counting claims.
And I see the 375 that is in the bill, the last page in section 23. That's pretty much the average between the low end, the 250, and the high end 491. So you hit it just about. It's hard to determine, right, how much we're going to need on this worker comp, which is going to be an issue for our local governments, certainly.
Yeah, it is. It is a little bit of rolling the dice. Those original numbers were basically on a year. The federal funding only goes through the December 30th, so it's taking all of those things into account. What could this commitment or obligation be? And right now, 375 has been the magic number, but and that's why there is reporting required going forward, so that if those numbers adjust and hopefully adjust down, those dollars can be used for something else.
Sure. Thank you. Mr. Moan, did you have any comments, or Ms. Fontaine?
Madam Chair and members, no, I do not know the value of the claims received so far.
Okay. And Ms. Fontaine, anything that you want to add to Senator Utke's testimony?
No, I don't believe so, Madam Chair. I think he did a very thorough job of explaining the intent of the language and what it's supposed to do.
Thank you. And for the record too, we have Mr. Aaron Cocking, who is the Executive Vice President of the Insurance Federation of Minnesota, on the call for any questions. And I see Senator Newman's hand up.
Thank you, Madam Chair. Senator Utke, you've described the eligibility criteria quite well, and I appreciate that. And it looks like we've got objective criteria in order to qualify. Is there anything in this bill, such as we have seen before, indicating on a first come, first served basis, or rather, do we have a bill that where objective criteria is satisfied and the local units of government are then qualified for the program?
Senator Utke.
Everything we see here, that it's not a first come, first serve. It would take all the claims that come forward. The one question was, private versus public entities. And we believe that that's taken care of because of the fact that all of our frontline workers are doing the same thing. They're serving our population, taking care of those that are sick, hospitals, long-term care. So we believe it's a fair across the board. Hopefully there's no winners and losers.
Thank you, Senator. Thank you, Madam Chair.
Thank you, Senator Newman. Ms. Fontaine, did you have anything you'd like to add to that?
Well, Madam Chair and Senator Newman, were you just talking about the presumptive class employees, or were you talking about the reimbursements from the from this fund that's being created? Because there is that language that talks about a first come, first served basis for the reimbursement requests.
Senator Newman.
Ms. Fontaine, could you then explain in a little bit more detail the first come, first serve basis for those claims?
Yes,
Ms. Fontaine.
There's language online, starting on line 31.8. Well, and it starts on 31.5, subdivision 4, discusses a very general process for submitting. It's not called claims, but it would be normally sort of a reimbursement claim, but it's a process to submit to the Department of Labor and Industry, the commissioner, and it would be a format prescribed by the commissioner, the information about the amounts that are in excess of the deductibles that were provided. But then it does say on 31.8 that the commissioner makes the reimbursements to the providers on a first come, first served basis. So it would be that as these workers' compensation providers hit the deductibles for each level of claims based on what type of insurer they are, and once they start submitting them, they would get into line first. So there is that an aspect there as far as these reimbursements from the Department of Labor and Industry.
Senator Newman.
Thank you, Madam Chair. Senator Utke, I'm not intimately familiar with your bill. I just want to make sure that we are not going to be dealing with a situation where we have local units of government or private entities, of different sizes that get in line ahead of another local unit of government and receive this help, while others, because they didn't get in line soon enough, somehow are not eligible. I'm uncomfortable with the language when we talk in terms of first come, first serve gets the money, and I would like your assurance, Senator Utke, that this bill is not dialed in that way. That we are going to treat all of our local units of government equally. They're all going to have an equal opportunity to qualify for these funds, and that if they're late and don't get in line first, they're not going to be disqualified.
Senator Utke, and then I will ask for some legal help on that.
Yeah, I will.
Okay. Thank you, Madam Chair and Senator Newman. As I'm reading that same portion of it, we talk about the commissioner shall make reimbursements to the workers' compensation providers on a first come, first served basis. And then it follows right up with no funds may be reimbursed after December 30th, talking about that's the end date of the federal funds. I don't, and I'll defer to staff a little bit too. I don't see how there would be any difference. I mean, if you and I both turned in our claims, one is going to get processed before the other, but we'd all have equal treatment as long as there's money in the fund. And that's why we've got what we think is a good amount in the fund. So hopefully we've got excess money that will even be returned. But unless somebody was really late, I mean, it's laid out when they have to have the last day for reimbursements and such. I wouldn't see that anybody would be left out as long as they followed along, what they're supposed to do.
And Senator Utke, you have actually 2 reports within the time frame of when the money needs to be spent, August 1st and November 1st.
That is correct.
That is an area that we could either tighten up or just assume that there will be a report back to the legislature. And I'm wondering if that needs to be clarified a little bit too. The legislature, or is it the chairs of the appropriate committees? I don't know. But perhaps we can tighten up a little bit on that section, subdivision 7.
Madam Chair, we could easily do that because, as you just mentioned, there's a report on August 1st and November 1st. The commissioner shall report to the legislature. We could spell out who those reports go to make sure that they are done. But that report is regarding reimbursements paid to the providers. So with that and those reports should hopefully cover issues that Senator Newman is concerned about, and rightfully so, that to make sure that we should see at that point claims submitted and basically reimbursements paid back out, and hopefully it's all on track.
Right. Ms. Fontaine, do you have anything to add to that? Is there?
Madam Chair and Senator Newman and Senator Utke, I was just going to say that I think the first come, first served language was more of an intent to say it would be like on a rolling basis, where sometimes when you have claims or grant programs that you don't start processing until a certain date. And this would allow for the specified workers' compensation providers to start submitting once they hit that that threshold, and so that they can start processing them. Again, a lot of times a grant program or something will say, there'll be an RFP and you'll wait, and then there'll be a date certain when they start to process. So I think that was kind of more a rolling basis. I know it says first come, first serve, but maybe that was sort of something they were thinking about. But then also with the there's such a difference in this deductible for the local governments and the self-insureds. With the lower premium, it's $100,000, and once they're hitting that, then they can start to apply for reimbursements. And then for the insurance carriers, the workers' compensation insurance carriers, it's $5 million. So it's quite a bit different. So I just, those were a couple of things I wanted to point out, that I think the intent was to, at least for these local units of government that maybe don't have a lot sitting around in reserves, to be able to start getting it. It may be that one of the local governments hits that threshold right away, for whatever reason. And you might want them to be able to come in right away and start getting the reimbursement. I think that was kind of what the thought was, but Senator Utke and Mr. Cocking can correct me if it was some other intent.
Madam Chair, the only thing I will correct is the deductibles on the small groups was 100,000, and on the larger entities was 1 million. Just with,
1 million. I'm sorry.
We raised them up a little bit. They might get a little concerned.
Okay. Senator Newman, are you good?
I am, Madam Chair, and Ms. Fontaine, thank you. Thank you, Senator Utke. You've answered my questions. It would seem to me that so long as this fund doesn't run out of money, everybody's going to be just fine. But I am going to rely on you, Senator Utke, that you've worked very hard on this bill, and that we aren't in a position where we're picking winners and losers, that we are going to actually get the help out to those local units of government that in fact need it. And that was my concern. So thank you very much.
Thank you, Senator Newman. Senator Champion.
Thank you, Madam Chair. I have a couple questions for the author. One is, I was curious as to whether these provisions that we saw as a part of the amendment went through the Workers' Compensation Advisory Group. So I'd like to know if that happened, and if not, why?
Senator Utke.
Madam Chair and Senator Champion, this funding proposal did not go through the Workers' Compensation Advisory Council. Of course, it was talked about some when the original bill was passed back in early April, but past history has shown that, the Workers' Compensation Advisory Council deals with Chapter 176, I believe it is, that affects workers' compensation policy and everything. Funding provisions have not traditionally in the past, and we go back quite a ways, have not gone before that council in an individual basis. So just working on past history, we're following exactly what's taken place.
Senator Champion.
Yes, Madam Chair, thank you. Senator Utke, thank you for that. It's my understanding, and again, I'm not the guru as it pertains to workers' compensation advisory, but I've always been told that everything related to workers' compensation, whether it's funding, a loan, would go through that council, because that group is a cross-section of individuals who speaks to those issues around workers' compensation, and that they want to get buy-in, or we as legislators have traditionally want to get buy-in from that council. So that's disappointing that that didn't happen. Here's my second question. Looking at the reports, the chair talked about the 2 reports, and then this bill talks about money has to be spent by December 30th. Are you, concerned with, or think we need to maybe button up whether there needs to be an earlier sort of cutoff date as to when, if the funds have not been used, that would make them open or available for some other COVID-related spending? Because I'm concerned that if we leave money on the table and if we don't get it out the door within the timelines set up by the federal government, that we'll end up needing to return those funds to the Treasury. So any thoughts about that?
Senator Utke.
I got put on mute, but anyhow, I feel that, we've got what, with the page, is it August and November? Anyhow, we've got the 2 dates that are going to give us hopefully a real good picture of what's going on. I think we're doing really well, and that's why those dates are in there. Is once we have a little history to this, we're going to know, are we going to push it up to the limit, or are we going to have money left over, or what are we looking at? And I think the plan is laid out pretty good, and that's why it's there, is so that as we move in on the end of the year, if there's extra funds and we've got other obligations within the state that could be used for, we've got time to move it. But just because of the limitations to the federal funding being December 30th, I mean, it's going to be a scramble, I'm sure, when December rolls around. But I think it's in a pretty good place right now. And Senator Champion, I hope you're watching the road and not too much of your camera, because I see you're in your car.
Listen, I'm parked. I'm parked in a parking lot, and I'm I'm stopped. So I wanted to just stop and have this conversation. So my last question to you is, Senator Utke, then what would be the mechanism that we would use in order to make sure that that money could be used in some other form or in some other place if the legislature is not in session? Is there a mechanism that I'm not familiar with that would come into play and could be used as a stopgap measure or a default mechanism that would be able to get the funds out?
Senator Utke, I'm going to let Mr. Nauman answer that, please.
Thank you.
Eric, Mr. Nauman, will you? Yeah, there you go. Thank you.
There was a notification on my screen. You're talking and no one can't hear you. Madam Chair, members, good morning. Under current law, I should say, notwithstanding Senator Rhodes' bill on this point earlier in the session, the LAC process would probably take over. The way this works is MMB would make a submission of a recommended expenditure out of the federal funds. The LAC would review those expenditures, and they would be spent if there were no objections. And the LAC is advisory. The point that I think is maybe helpful for Senator Champion is that I presume that MMB and the agency itself would be monitoring the ongoing expenses, particularly because of the reporting requirements. And if it looks like there would be money available at the end, I make the presumption, although I don't know for certain, that MMB would begin allocating some of those federal funds to expenses that state government has incurred as a result. So I think that would be the backup mechanism to ensure that the money is spent by December 30th.
One last question, if I can, Madam Chair.
Senator Champion.
To Mr. Nauman. So would it help if there was a, I hate to use this term or phrase, like a drop dead date that would say, those local municipalities would have to have, submitted their information by X date. If not, then we can be in a good place to presume that there's nothing else that's coming in that would interfere with those funds and therefore be available for that commission to step in?
So, Senator Champion, that there is a drop dead date in my bill that deals with the local government aid that's going out, and that is November 1st. And that was October 1st. It was at the request of the different local governments to move that up 1 month to allow them to capture all their expenses and make sure that they could legitimately show that they have these COVID expenses. And then from that point, the money can, and we've had this discussion already, but the money can be maneuvered around, and other governments, local governments can capture that money, or other issues of COVID related can capture that money. Mr. Nauman, anything else that you want to add to that?
So, Madam Chair and Senator Champion, I just only add that December 30th is the last. I think the reason we're talking about that particular date is because it's the very last sentence basically in the bill. It says the money is available until December 30th, 2020, and that's from the guidance. As long as the money can be, that's the length of the duration in which the money can be spent. I'm sure MMB would say to you, if they had an extra week, that would allow a little bit of timing comfort. But I think that MMB could also work with this because they would be monitoring the expenses. So I think there's a legitimate decision that could be made there. It's not absolutely critical in my judgment.
Thank you, Mr. Nauman. Senator Kiffmeyer. Senator Kiffmeyer, you're on mute.
Thank you very much, Madam Chair. Thank you. So in regards to this, I remember this question being asked before. I've never heard this come up, that MMB in this particular amount of money would have some authority to redirect and do some other things with that. That is new to me. and brings up a concern. The other thing is that in regards to the Workers' Council voting on this, when we asked the question in State Government Committee about did the Workers' Compensation Council anticipate or expect, basically saying yes, they passed this, but also with the understanding that money would follow. I would consider that the Workers' Compensation Council did approve and did want and did expect this to be a funding mechanism. Thank you, Madam Chair.
Thank you, Senator Kierkemeyer. And I will let Mr. Nauman answer this, but right now the money does sit with MNB. And that's why we did pass that bill to make sure that the legislature is the one that appropriates it by law. So yes, it does sit with MNB now under the LAC requirements. And Mr. Nauman, anything else you'd like to add to that? No. Okay, Senator Marty.
Thank you, Madam Chair. I just wanted to comment one more thing on something Senator Champion mentioned earlier, and that is going through the Workers' Comp Advisory Council. I've found times and things that are not in chapter, 176, that they have said, oh, we haven't had a chance to look at this yet. Things related to worker safety, other issues that are not really strictly that. I was just going to say, generally, I can't speak to the funding issues, but that the council has been wanting to be involved in everything like that. And I just think it's a better idea in that case to have all these things go through there so all sides get to hear this. So it's just a general comment that I've seen Workers' Comp Advisory Council claim jurisdiction over anything that in any way looks like it might smell like workers' comp. So anyway, just wanted to make that comment.
Thank you, Senator Marty. Okay, any further questions? I will turn to you, Senator Utke, for closing comments and maybe a reply to that, but any other questions?
Yep, no, thank you, Madam Chair and members for listening to all of this. And I will just add one more little comment to the fact of the Workers' Comp Advisory Council. Yes, they do get involved in just about everything, but usually it involves the workers. Whether it's workers or the industry, it's some sort of policy, whatever. This is financing the obligation that we passed with the presumptive language. And so this is strictly dollars and cents. This is trying to make that account sustainable. Without this, there still are a lot of unknowns, but if claims do come in bigger numbers, like some of that, we called it rough modeling, but it's an estimate. If they came in on the high side, I mean, that's a lot of money. It would put a lot of these insurers under.
They might work, but they might not, you know.
Somebody has their, can you please mute? There you go. Thank you very much.
Okay.
Senator Utke.
So, you know, this is all about keeping, you know, first of all, we passed the legislation to take care of our workers. Now we're just having to put forth the money to cover these possible, you know, we're seeing that there's already some claims. We don't know the exact amount, but, you know, once we leave here this coming Monday, there's a number of months ahead that these claims and stuff will be coming through, and we just need the funding source for it so that the work comp system stays sustainable. Otherwise, in work comp, when they make payouts, where does the money come from? It has to go back to the employers. The employers pay it, their classification codes, their payouts go up, and then they just pay higher premiums for a number of years till that pool is paid back. And we're trying to head that off because, you know, we've had a lot of different bills related to COVID-19. This is different than anything else we've done. And in this case, we're working with work comp and trying to make that system whole also. So with that, Madam Chair, I thank you for.
Thank you, Senator Utke. Very, very good. Okay, with that, Senator Ingebrigtsen, would you like to move? Who is speaking here?
Senator Westrom.
Senator Westrom, there you go. Senator Westrom.
Madam Chair, I have not been able to log in on my computer. I'm not sure exactly why Zoom's not working, so I'm just letting you know for the record, I have been joined by phone the whole time here.
Oh, okay.
And I know we don't have a provision exactly yet to allow people or the chair to make the exception, but that's the best I can do right now.
Okay.
To vote and participate.
Thank you,
I'm trying to
Senator
get logged
Westrom. And I
on.
know we had some difficulties last night too, so I appreciate that. Okay, we are going to take the vote on Senate File 4130 as amended. Senator Ingebrigtsen, would you like to move the bill?
Madam Chair, I would make that motion.
Thank you. Senator Ingebrigtsen moves that Senate File 4130 as amended be recommended pass and placed on general orders. Please unmute. All those in favor say aye.
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 All those opposed, nay. Motion prevails. Thank you, Senator Utke.
Thank you. Thank you very
Okay,
much.
thank you so much. Next bill, we have Senate File 3226, Senator Housley.
Thank you, Madam Chair. Senate File 3236 is to allow for third-party driver's license exams to be done by a third party. We've all heard the stories in the news or even from relatives or even your own kids about how difficult it has been to get your driver's license behind the wheel test. People are driving hundreds of miles, booking their appointment months in advance, and if you fail, then you got to go back into the queue and wait again. Parents are taking off work to drive these distances to get their kids their driver's license exams. So they're sleeping in their cars, hoping that a spot will open up. Minnesotans are getting really frustrated with the agency's inability to efficiently schedule and conduct behind the wheel examinations. So what this bill does, it allows for third-party testers to give these kids their behind the wheel exams and to reduce the backlog at Department of Public Safety. It's a simple bill, but there is a fiscal note attached to it. So that's why I'm here in finance, Madam Chair.
Thank you, Senator Housley. We do have Ms. Boyd and Ms. Stengel available to run through the bill and the fiscal implications. If you'd like to turn to them, or would you like to talk about the fiscal?
You know what, I'll defer to them. Thanks.
Okay, thank you. Who would like to start first? Ms. Boyd?
Yeah, good morning, Madam Chair.
Good morning.
There's a fiscal note on this bill, but I'd like to point out first of all that Section 15 of the bill states that the requirements of the bill should be implemented with existing resources. So the fiscal note shows the costs as assumed by the department that it would incur as a result of this language, but there is no indication that the costs will be absorbed in the fiscal note. So I just wanted to point that out. The fiscal note, if you look, it's all in special revenue fund. It's mostly in the, I'm sorry, I'm blanking. It's mostly in the driver services operating account, but there's some costs from the driver and vehicle services technology account, but they're both in the special revenue fund. So if you look at fiscal year 21, there's a cost of $415,000. And those are one-time costs. Most of it, about $224,000, is related to programming of the driver system to allow these new third-party testers access and to the system and to be able to communicate information back to DVS. There's also a cost of about $191,000 for equipment, et cetera, for new staff assumed in the fiscal note. Then there are ongoing costs starting in fiscal year 22 of about $2.6 million. Most of that, the bulk of that cost, is related to the assumption of new FTEs needed at the department, mostly to be auditors of the new testers and 2 management staff, and I think 1 clerical office worker as well. And then there are costs related to that for things like vehicle leases and office space and things like that ongoing related to the new FTEs. There was one other thing I wanted to point out, which I can't remember now. But that is the bulk of the cost. Oh, what I wanted to point out is that the main assumption of the fiscal note is that they had to assume how many third-party testers would be as a result of this bill, and they assume about 325. So that's where they set their staffing level in order to audit all of these third-party testers and the programs they belong to.
Thank you, Ms. Boyd. Any questions for Ms. Boyd? Ms. Stengel, anything that you would like to add to this? No? Okay. Senator Newman.
Thank you, Madam Chair. I did want to weigh in on this bill a little bit. It did start in the Transportation Committee, and I just want to give you a little bit of a background, members, and request that you really seriously consider Senator Housley's bill, because, you know, in my opinion, our system is going to be completely overwhelmed unless we do something significant in order to reduce the anticipated backlog. There are currently 3 proposals sort of on the table to try and address the backlog that is coming, and I'm going to give you those numbers in just a second. The 3 proposals are Senator Housley's bill, which would allow third-party testing for Class D licenses. DVS is proposing third-party testing for CDL licenses. And there is a movement in, I believe, the other body that would allow the issuance of licenses without any testing at all. That is something that has been done in state of Wisconsin and Georgia. I think it would be just a horrible idea. And I think statistically that would be borne out, that that is not the direction the state of Minnesota should go in. But they are the only 3 possibilities that I am aware of. So in reality, what we're down to is either going with the proposal from DVS to allow third-party testing, or go with an idea like Senator Housley has with third-party testing on Class D licenses. We did, for instance, a year ago, allow third-party testing on school bus driver's licenses. It has worked. I have received, personally, I haven't received any kind of complaints or problems with it. And consequently, I do think that DVS would be able to implement third-party testing for CDLs. Although I think CDLs are somewhat more complicated, I think that they would be able to do that. But just consider some of these figures. Currently, there is a road testing backlog of in excess of 13,000 tests. Of those 13,000 tests, 12,300 are Class D licenses, and 814 are for CDL licenses. It is anticipated by the end of this year. I'm looking at a document that DVS has prepared regarding their plan to address this backlog, and without question, DVS acknowledges there is a problem here and there's going to be a backlog. The end of the year, between all of the different kind of licenses, the backlog in December of 2020 will be 111,500 tests that we will be behind on. Of that 111,000 tests, 102,000 are on Class D licenses. So I hope you can see where I am heading here, in that we have to work with DVS in order to find an answer to this problem. But I honestly cannot see a situation, given what has happened with COVID. We were behind before COVID hit, and it is just accelerated at this point. And I sincerely believe that our system is going to be just absolutely overwhelmed unless we do something like what Senator Housley is proposing, to go to third-party testing. And we've got a lot of constituents, all of those parents that have got 16-year-olds that want to get a driver's license. They are going to be pretty upset with us unless we do something. And I have been getting emails on this, and there is great concern out there. So I just wanted to mention to you, members, that this, I believe, is going to be a very serious matter for us to try and address in the future. Please listen to what Senator Housley's bill is trying to do, because if we don't head in that direction, our system is going to be overwhelmed. We simply cannot fix this problem by going to third-party testing on CDL licenses. Mathematically, it just doesn't line up for me. So that would be my thoughts, Madam Chair. Thank you.
Thank you, Senator Newman. Senator Cohen.
Madam Chair, and I'm not sure, Senator Housley, and I don't obviously serve on Senator Newman's committee, but I believe we had something, I had seen something from the Department of Public Safety indicating opposition. So one, I don't know if there's anybody who wants to speak to that from the agency. Second, if not Senator Housley or Senator Newman, why do I think I saw something indicating opposition? And three, when we talk about third parties, who would be the third parties in terms of, you know, what's the limitation on the third parties or access to the third parties?
Yeah, Senator Cohen, we do not have anybody from the agency on board. I will turn to Senator Housley and Senator Newman. If you have something to add, please let me know.
Thank you, Madam Chair and Senator Cohen. These would be a driving school could apply, go through the same criteria that our state party testers do. So they would go through that driving school in order to become a third party tester. It doesn't have to be a driving school. It could be an independent business that wants to get into giving driver's license exams, but they would go through the same criteria that our state driver's test examiners would go through.
Senator Newman.
Yeah, thank you, Madam Chair. Just to answer Senator Cohen's question, you may be referring to a document that DVS recently put out. It's titled "Plan to Address CDL and Class D Road Test Backlogs," dated May 11th, 2020. You know, I could go through it. I'm not going to do it during this committee, but I could certainly forward that to you. That may have been what you were thinking of. I'm not sure.
Well,
Senator Cohen.
So, Madam Chair, Senator Newman, was there any opposition expressed in your committee?
Senator Newman.
Thank you, Madam Chair. Senator Cohen, the answer is yes. DVS is in favor of doing third-party testing on CDL. They do not favor third-party testing for Class D licenses. DVS does, in fact, want to hang on to that. And my point is that their plan, I've looked at their plan, and I just sincerely believe it will be inadequate, that the backlog is going to continue to mount, and I don't see a way out of it other than we are either going to have to adopt a plan such as Senator Housley is proposing, or we are going to have to pony up enough money so that DVS can hire permanent staff to administer these tests. And keep in mind, you know, this social distancing is a real problem when it comes to road tests. I don't see that we are going to be able to come up with the money necessary to have DVS hire more staff in order to address this backlog. So in my mind, the only realistic approach is third-party testing for Class D driver's license, because otherwise I simply don't know where we're going to get the money to erase this backlog.
Thank you.
Senator Franzen. Senator Franzen.
There we go. Sorry. I was looking at the bill, trying to multitask with one screen. Thank you, Senator Madam Chair, and Senator Housley for bringing this along. Senator Newman, there is one more option out there. Well, actually two more. For instance, the governor of Georgia has basically suspended the requirement of the test during the pandemic. So that's one option that we can be creative and say maybe potentially, I'm not saying this is a good idea, but there's options that we can suspend it for a period of time And then as we gear up, we can go back to validating those licenses. That is out of the box, just thought about it. But the other piece too, Senator Bigham is also, I just signed on to her bill, which is also looking at using remote cameras to basically step into place of the actual test. So a virtual exam, if you will. So that's going to be another option that's actually going to be on the table because Senator Bigham has just introduced that bill and I signed on to it yesterday. So there's creative ways to doing this. I don't necessarily think going third party or private or out of the state necessarily at this moment is necessarily the best option. You still have to, what I heard is that you still have to hire some people in DVS and Department of Public Safety anyway in DVS. So we'll have some, you're adding more FTEs even with this bill at the agency level. So I'm not sure if this is the right solution. I'm not sure that I want to support it at this time without having other options. And I do sit on transportation, so I heard this bill before. I just wanted to chime in with that.
Thank you, Senator Franzen.
Yeah, Madam Chair.
Senator Newman.
Thank you, Madam Chair, and Senator Franzen. The notion or the idea of a suspension of the driver's test, at least in my mind, is really not much different than just repealing the road test altogether. For me, it's a matter of public safety. That to have someone operating a motor vehicle on public roads without having shown that they can safely do so, to me is public safety. And while suspension is an idea, that is really what I was talking about with when I mentioned Georgia in the first place. So that is not something that I would support. As to the bill that you mentioned that Senator Bingham is bringing forth, I'm not aware of it, but I will tell you that in the DVS plan to erase the backlog, one of the components of their plan is to do exactly what you have just mentioned, and that is to use cameras in remote vehicles to try and help erase the backlog. I hadn't gone through all of the different steps in DVS's plan, but that is certainly one of them. I think it would probably help. But when I look at the backlog that is anticipated by the end of this year, it is so massive that I just don't see that it being a workable plan.
Thank you, Senator Newman. Senator Benson.
Thank you, Madam Chair and Senator Housley. I appreciate this, and I do have a number of constituents just because of the age of my kids. I also have a number of friends. So kids going to college who are going to drive to college and can't possibly get in testing. So I like the idea that we're expanding capacity. And even when we didn't have COVID, I had to take my kids back to the county I grew up in order to get a test in less than 3 months. And so I think the innovative ideas that DVS might be working on, or as represented by Chair Newman, are working on, they might come online, but we don't have them before us now, and we can't act on them now. And Senator Housley's bill has had a hearing, is going through the process, and I feel like it has some good measures in it so that those third-party testers aren't just, Joe off the street, that they're going to have to meet some standards. So given the choice of having 16, 17, 18-year-olds just get a free pass for a few months and try to solve this later, or having a third-party tester come in, I would choose the third-party tester, because I've seen some 16-year-olds and they should not get some of them should not get a free pass. So thank you, Senator Housley, for this legislation. I think it's a practical solution to a rapidly growing problem.
Thank you, Senator Benson. Senator Marty.
Thank you, Madam Chair. I have some real concerns about this. I agree we've got a crisis right now, but the underlying backlog, the backlog we had prior to this, is something that we've not provided the staffing for DVS to do this. It strikes me that that's the kind of thing we should be fixing not saying we're going to open it up to anybody who wants to do it. The driving school, testing their own students for graduation, I guess I see so many conflicts in there. I would rather have what Senator Housley is proposing just during the crisis, just during the time when we've got this backlog exploding. If we have to do something, that would be better than not letting people have any tests or anything. But for long term, we're actually going to say that this is something that, well, Sheriff's Department doesn't have enough employees, so let's hire out people to be private deputies on their own. I mean, I think that's a terrible idea. This is a public function. It ought to be done by the public. There are truly conflicts of interest involved in this. And I guess I just see that we're starving the department and then saying, well, they can't handle it, so let's have somebody else do it. And I guess I am really troubled by this. I'd be open to this for a short-term function during the crisis, but not long-term to say we're going to just replace what should be done by standards that are met by people who don't have any conflicts. I guess I think this is a bad step to do permanently. And again, I'm open to it for a short-term fix, but not for a long-term solution, because the real solution is make sure DPS has the right people to do the tests. And of course, it's going to be a growing backlog. If you're short of people and you can't provide it, and you're not going to provide them more staff to do it, then you're going to get a worse backlog over time, even without a crisis. And that's something we've got to fix as a legislature, not turning it over to somebody else.
Madam Chair.
Senator Housley.
Thank you, Madam Chair and Senator Marty, for those comments. We heard the same thing that you just said when it came to the school bus drivers third-party testing. And in committee, that bill went through, and people were opposed to it for exactly the reasons that you said. But the bill passed, and the state was okay with it, and it's working just fine. So I understand where you're coming from, and I can see your concerns. But the sky didn't fall when it came to school bus testing.
Thank you, Senator Housley. Senator Ingebrigtsen.
Yes, thank you, Madam Chair, and thank you, Senator Housley, for bringing this forward. I have to be reminded again what this cost is, but let's think those private sector folks out there that bring those kids to the time that they have to take their test. If it wasn't for them, they would not be able to pass the test. So this certainly seems to be a good idea to me, and a real good trial basis. Maybe we can look at down the line privatizing some of this stuff. I know the public is certainly in favor of that, but you've got tech school people out there that teach truck driving that be very capable of doing CDL testing. And for goodness sakes, if the bus driving thing is a success, we need to try this as well. And I look for something like this to move forward and probably stay in place. So I think it's a good bill.
Thank you, Senator Ingebrigtsen. Senator Limmer.
Thank you, Madam Chair. I just want to thank Senator Housley for bringing this forward. My own personal experience has been with 3 kids, and this is 5 to 8 years ago. This was a problem then, it's a problem now. There is inadequate supply of testers for our kids wanting to get their driver license. I've had to get up at 3 in the morning to get in line with my kids repeatedly, and they weren't the best driver at the first round that they went through. And so we had to wait another 30 to 45 days to get back on a schedule. And then you only had an opportunity to get to the day. They didn't even schedule you by the hour. And then you had to stand in line with your car, with your kid in the car at 3 in the morning and wait as other parents were lining up in front of you and behind you. The state has provided an inadequate service and an inadequate supply of driver exam licensors. And this has been growing for so long. It needs to be resolved. And I think Senator Housley's bill will do that. This is not just a problem regarding COVID-19. This is a longstanding problem, and the state has not resolved it. So often when government thinks that they can do the whole service without getting private sector involved, it just is inadequate. It's just inadequate.
Thank you, Senator Limmer. With that, I think we are ready for closing comments, Senator Housley.
Oh, thank you, Madam Chair. And thank you, members, for hearing this bill. The driver's license backlog was a huge issue even before COVID-19. And thank you, Senator Newman, for doing those numbers to have, we'll be behind by 111,500 tests by the end of December. Wow, something does need to be done right now. I'm glad this bill has gone through the committee process. There are other bills out there. We even do have one in the Senate to just have parents sign off and get kids on the road immediately. I don't think that's the solution either. These third-party testers are qualified. We can make sure that the kids are out there safe and everybody else is on the road safe. So thanks for hearing this, and I hope it passes through your committee, Madam Chair, and gets to the floor and we can get these kids tested and on the road. So thank you.
Thank you, Senator Housley. And I think Senator Limmer's story was very, I'm so glad my children are older. Wow. Okay, Senator Newman, would you like to move that Senate File 3226 be recommended to pass?
Does the bill, Madam Chair, go to the floor?
Yes, placed on general orders.
Yeah. I would move that the bill be recommended to pass and be placed on general orders.
Thank you. On that motion, members, please unmute. And if you can, video. Wonderful. All those in favor say aye.
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 All those opposed, nay.
Aye.
No.
Motion prevails. Thank you, Senator Housley. Your bill is going to the floor.
Thanks, Madam Chair.
Thank you. Senator Nelson, we have one more bill up. We can start at least. This bill will be laid on the table, but there is, we do want to concentrate on the fiscal part of it, the spreadsheet. Members, it's the it's her Omnibus pension or E12 bill, or finance bill. So Senator Nelson, Senate File 485.
Thank you, Madam Chair and members. First, I have a delete all amendment, and that would be the A1, which should have been sent out to you. I also saw it's on our Finance Committee page as well. I do want to make sure members have that. Members, this is the school finance adjustments related to the COVID-19 emergency. That is the language before us. And the finance chair had said she wanted to see this bill, so we are glad to bring this forward. This is the agreement reached upon between the House and the Senate on Saturday evening. And so this is the language, and we did not have a spending target, and so there is not any spending. In fact, the bill before you actually saves the state general fund $3,000. So, and I do have the spreadsheet, which you should have available as well. And to that spreadsheet, Madam Chair, I'd be glad to have, I do have the education fiscal staff on board here as well, and they'd be glad to go through the spreadsheet. I think members will want to take note. This is the shortest education spreadsheet for finance I think we've ever seen. I think there are 12 lines instead of hundreds of them. But again, this is just specifically related to school finance adjustments that are needed because of the COVID-19 emergency. And as you know, our students have been out of school learning via distance learning since mid-March. And that's what this bill addresses.
Thank you, Senator Nelson. I appreciate you concentrating on the spreadsheet and the financial component of the bill. Ms. Hofer.
Thank you, Madam Chair. Committee members, in your committee packets for today, you should have a spreadsheet in the upper left-hand corner under 2020 Legislature Senate E12 Education Committee. It should say change items for SCS 0485A-1. The timestamp in the upper right-hand corner should say May 13th, 2020 at 4:20 p.m. As Senator Nelson noted, this is one of the shorter E12 spreadsheets that we have. This just shows the change items. So this is the change from the February forecast base. And so on line 1 is the early middle college program. So this would be an increase in spending of $65,000 for fiscal year 2022 and $72,000 for fiscal year 2023. This corresponds with Article 1, Section 1, which is on page 1 of the bill. And this just makes permanent the graduation incentives program, which allows an English learner with an interrupted formal education who is at least 21 years old, but not yet 22 years of age, to continue being served by an early middle college program. Line 2, Achievement and Integration Aid. So this corresponds with Article 2, Section 2 on page 4, as well as Article 2, Section 6, Subdivision 11, which is on page 8. So what this does is this allows the Achievement and Integration Aid for fiscal year 2020 to be carried forward into fiscal year 2021. And so according to the budget rules, this needs to be shown as a reduction in the year that it's being carried forward from, and then an increase in the year that the money is being carried forward to. So you see that reduction of $708,000 in fiscal year 2020. Because Achievement and Integration Aid is paid 90% in the first year and 10% in the final year, that's why you see the little bit of a difference in fiscal years 21 and 22. You see the $630,000 increase in fiscal year 2021, and then the remaining 10%, the $78,000, excuse me, in fiscal year 2022. Line 3, Developmental Screening Aid. So this is a reduction of $10,000 in fiscal year 2020 and an increase of $1,000 in fiscal year 2021. And this corresponds with Article 2, Section 4 on page 5 and Article 2, Section 6, Subdivision 11 on page 8. So the developmental screening aid goes out based on the number of children who are screened by a district. And with the transition to distance learning, a lot of schools have canceled their developmental screenings for the remainder of the school year. So this bill would allow developmental screening aid to go out to districts based on the number of children who were screened in fiscal year 2019. Line 4, statewide testing and reporting system. This is a reduction of $180,000 in fiscal year 2020. And this corresponds with Article 2, Section 3 on page 4. As a result of the statewide testing being canceled for this year, partially part of the way through the testing period, the Department of Education has told us that there would be some savings associated with not doing all of the grading of the tests. And so there would be $180,000 of savings for that. On page, line 5, Pellsby Teacher Licensure IT System. This is a $49,000 cost in fiscal year 2021, and this is associated with Article 2, Section 5 on page 5. So in the bill, Pellsby is required to issue conditional licenses, as well as extend the filing date that teachers need to renew their licenses. And so part of them transitioning to a conditional license is they need additional money to upgrade their IT system to be able to process the conditional licenses. And so with that, the total appropriations in the bill for the 2021 biennium, you'll see a reduction of $218,000. And then for the 2022-2023 biennium, there's an increase of $215,000. On line 10 under revenue, you'll see teacher licensure fees, and this is associated with what I was just describing for Pellsby, extending the expiration date of some of those licenses by 6 months. And so as a result, there's a reduction of fee revenue in fiscal year 2020 of $342,000, and that same amount is shown as an increase in fiscal year 2021 as those teachers are expected to renew their license in a different fiscal year. And this is associated with Article 4, Section 1, Paragraph C on page 10. And so then on line 13, you can see that the net total of expenditures and revenue for fiscal year 2020-2021 is $218,000 in savings. And for the tails biennium of 22-23, there is an increase of $215,000. And with that, I will turn it back over to you, Madam Chair.
Thank you, Ms. Hover. Senator Cohen, you've had your hand up for a while. Was there something before we started?
Madam Chair, just this is more parenthetical. You and I have talked about this. I'm not blaming Senator Nelson, but Senator Nelson, if I can inquire, you indicated the House and the Senate agreed on this. Who's the House and who's the Senate? And when did we agree? And where did we agree?
Madam Chair?
Senator Nelson.
Oh, thank you. Senator Cohen, this would be the House Policy Chair, Representative Dabney, and myself as the Senate, did I say policy? Finance. Representative Dabney is the chair of finance in the House, and me as the chair of both, obviously, education, finance, and policy of finance in the Senate. And of course, as was requested by our leaders, to come to agreement by midnight on Saturday night. And we did come to an agreement on this finance bill Saturday evening, and that would have included Chair Dabney and his staff and me and my staff, and the commissioner weighed in as well. And it is agreed upon package. So that's exactly what we were asked to do. We all had to set aside things that we thought were really terrific, but we did so for the broader good of making sure that we get out to our schools the flexibility and the appropriated funding, even though much of our funding is based upon how many kids sit in desks for so many days, for so many hours. And so it was that Saturday night agreement, Senator Cohn, just as we were asked to do by leadership, which I think other jurisdictions have been asked to do as well. Actually, we were all asked to do that.
Senator Cohen.
So Madam Chair and Senator Nelson, my comment is both a criticism and not a criticism. First, these are unusual times, and nobody expected when session began on February 11th that we would be having committee meetings as we are right now. So a lot is been going on that is unique, unusual. My concern is that what you just described was the conference committee process last year. You might recall yesterday on the floor of the Senate on Senator Chamberlain's bill, which I supported, Senator Howe attempted to offer an amendment, and Senator Chamberlain said, well, this has been agreed to by the House and the Senate, and we can't do anything. And Senator Howe said, well, how about a conference committee? And I'll like, I'm sure you and I have talked about this, and I'd like to discuss this later, not in committee, but maybe on the floor for a couple minutes. And again, Senator Nelson, this is not a criticism directed toward you. One, as you suggested, leadership directed you, leadership, I assume, meaning Senator Gazelka, Senator Rosen, or any other unnamed leaders, directed you to a schedule as to what you had to do, session come to the end, and so on. My concern is, again, this is not directed toward you. It's not directed toward one party or the other. There are times when I was someone who, in a couple of instances, was not very proud of how the process was handled when I was in charge. And now it's just totally disintegrating. Again, these are unusual times. These are unusual bills. My fear is that we're going to have a couple of generation of legislators who have not a clue as to how to conduct an open, transparent process. And again, I will repeat myself, Senator Nelson, it's not a criticism of where we are today because of the very unusual situation, and it's not a criticism of you, majority caucus in the Senate. It's a collective criticism of both parties, both bodies that has been going on. I can almost, okay, I don't want to belabor this too much, Madam Chair, right now, except to say, I can give you the beginning point, I believe. And it happened to have been X number of years ago. And it was at a time when Democrats had the majority in the House and the Senate. And I can give you the particular bill in the particular room, and where I think this began. So, Madam Chair, this is the Finance Committee. My concern right now is that a fear that next year during the session, a budget and tax year, I think there's every chance we will have a legislative session similar to this one in terms of Zoom committee meetings, all the rest of it. I tend to be a pessimist on all of the COVID-19 stuff. And if the process continues with a very difficult budget and tax year, we will Minnesota will look worse for it. So, sorry, Madam Chair, you and I've talked about this, and I decided to pick on Senator Nelson just because she was the first person available.
Thank you, Senator Cohen.
So, Madam Chair, if I could answer some of those questions.
Well, actually, we were trying to get your bill out before 10 o'clock. So
I would love that. I will just say briefly that I think the public needs to know the agreement certainly can be posted online, but it was from Speaker Hortman, Representative Dowd, Senator Gazelka, and Senator Kent. So that was the leadership agreement that was sent to all of us, at least all of the chairs, about needing to come to agreement by midnight on Saturday. So I wanted to make sure.
Yeah, Madam Chair, I'm not chastising what's going on right now. Very unusual, but I'm fearful of we're on this trend. It becomes more and more acceptable because it's the easy way out. This year is a very difficult situation. I'm sorry, Madam Chair, I didn't realize you were trying to get the bill out this still in this morning meeting.
Thank you, Senator Cohen. Thank you, Senator Nelson. Any further questions on the spreadsheet and financial implications? And with that, Senator Nelson, would you like to move the A1 amendment?
Yes.
Okay, we are going to vote on that. So please unmute. And I know Senator Westrom's having problems with his video. Thank you. All those in favor of the A1 amendment, please say aye.
Aye.
All those opposed, nay. Motion prevailed. Thank you very much. A1 amendment is adopted. With that, members, we're going to lay Senate File 485 on the table, and we are going to be in recess and reconvening this afternoon on Senate File 4495 and Senate File 92. So please keep an eye on your emails for updates and the agendas, anything else that changes. With that, we are in recess. Thank you very much, members.